This is superior temporal line. Superior, the backside inferior temporal line. This is superior temporal line. Okay, and this is greater wing of sphenoid bone, and this area is known as pterion. Okay, and here this area is known as asterion. This is known as asterion. Okay, and this area, this is known as infratemporal crest. This area, this swelling is known as infratemporal crest. Here it is infratemporal crest, and below this zygomatic arch it is infratemporal fossa, and we will have one V-shaped crack. One crack will go above, one crack will go below. Above crack is known as infraorbital fissure, below crack is known as pterygomaxillary fissure. Inside that fissure, pterygopalatine fossa is present. Okay. Then this is external acoustic meatus, and this is this is mastoid process. This external acoustic meatus inferiorly and anteriorly made by tympanic plate. So between these two bones there is a gap. That gap is known as tympanomastoid fissure. Tympanomastoid fissure. Then this is the root of the zygomatic arch. This is anterior root. This is posterior root. Before the root there will be a projection. It is this is articular tubercle. That projection is known as articular tubercle. And posterior to and in the medial aspect there will be a fossa. It is known as articular fossa. Anterior side of this articular fossa is known as postglenoidal tubercle. Postglenoidal tubercle. Okay, postglenoidal tubercle. Then in the inferior aspect, this is known as hard palate. There will be a foramen in midline. It is known as incisive foramen. Then we have one foramen called greater palatine foramen. Followed by we will have two foramens, lesser palatine foramen. Lesser palatine foramen is a paired one. In some skulls only one will be seen. Okay. Then center in the middle one large hard bony structure will be there. It is known as bar shaped bone. In the bar shaped bone side we will have by irregular foramen. It is known as foramen lacerum. Lateral to that one large circular foramen will be there. It is known as oval. Just posterolateral to the oval we will have one foramen, and it will have one projection. Posteriorly to that foramen one projection will be there. That foramen is known as foramen spinosum, and this projection is known as spine of sphenoid bone. Spine of sphenoid bone. Posteromedial to this foramen spinosum we will have one foramen, but that foramen will not communicate inside. That foramen is known as carotid canal. Behind carotid canal we will have one large depression and foramen. That foramen is known as jugular fossa. And followed by that in the medial aspect we will have another one foramen. It is known as anterior condylar canal. This projection is known as condyle. Okay, and this is posterior condylar canal, and this is anterior condylar canal. Foramen magnum and mastoid foramen. Mastoid foramen. So you put this in group.